to myself. So let's recap what I just said. The first term, right? In order to talk about something in a complex way, we have to understand the vocabulary of it. And so one of the ways that insurance companies, I'm not gonna say get over it, but one of the ways that makes insurance complicated is that they use a lot of words that can be confusing when you're trying to read your contract and your policy and see what's up. So the first word is premium, and that is what you pay on a monthly or an annual basis to have access to insurance, to even have a chance for the insurance company to cover what are your costs in healthcare. And so every single month you pay in. And if you missed what I said, in 2023, the annual average premium for a family was $22,000 and $463. So $22,000 for a family in 2023. That's up 43% from the past decade. So it's a huge increase in the amount people are paying just to have access to insurance. Now, that's the word most people understand. The other word that is very complicated to people is the deductible. Who knows what a deductible is? What be's a deductible? Good afternoon, Joel. What is a deductible? What does that mean if we're talking about a deductible? I've always wanted to do that. Just, who's your favorite rapper? Just coming at you live action right now on the microphone. All right. What is a deductible, guys? So we pay every month to have access to the insurance. But then the insurance company's like, well, wait a minute. Before we just go ahead and give you money, we want you to put some skin in the game, put some money out. And so the deductible is what you have to pay out of pocket before the insurance kicks in. So maybe you have a $3,000 deductible, a $1,500 deductible, a $5,000 deductible, a $10,000 deductible. And you agree that I will pay all this money before the insurance company kicks in and pays something. Yes? And so the amount of your deductible is actually very important. And insurance companies leverage the deductible to trick you, right? They say, hey, listen, your premium is really high. Would you like a lower premium? Well, to give you a lower premium, what we're going to have to do is raise your deductible. And so they'll say, listen, instead of paying $1,000 a month, you go ahead and pay $900. That's $100 a month saving. You're like, woohoo! And like, yeah, don't worry about this, but your deductible's gonna go up by $2,000. Oh, well, deductible, I don't know what that is. So, okay, go ahead, right? And so your deductible goes up higher. And so these are what we call high deductible plans. And so I want you guys, as always, right? I'm giving you guys the facts, but the facts lead me to know something that's true. And the something that's true is that insurance companies are for-profit companies designed to maximize profit. And the insurance model is that they collect all the money up front, and we're going to get into this later and talk about this and how the money flows, but they take in all this money and they have to keep all that money to profit. And so they're going to use all these terms and policies to keep your money. Yes, yes? So with the deductible, a high deductible plan, this is important, a high deductible plan. This is killing people. Killing people. A high deductible plan. They will mortgage you into a high deductible plan to lower your premium, but then they're off the hook for so much of the services you need. And the odds that people spend $10,000 in a given year is low. So they're going to keep all that money. Over the last decade, okay, so we're going to talk about stats and facts. We can't talk about fiction because opinions, right? What are they like? We don't want opinion, we want the facts. Over the last decade, the average deductible for employee-sponsored insurance, so it's the cheapest, right? It's the most economical for people, has doubled. Doubled. The average deductible is $1,700 for a single person's coverage. So for a family, that's 4x. So the average deductible for a family in America is roughly $5,000, $7,000, even $10,000. Meaning insurance ain't covering nothing, yo. Nothing. So in the last decade, the average deductible has doubled and is now $1,700 per person per year. How many of you guys have spent $1,700 in healthcare in a year? It means you're paying for all your insurance. You're paying for the insurance and you're paying for all your care. Now, beyond the deductible, we have the copay. The copay. Who has heard of the copay? I'm going to take this off till we get to the real complex stuff. I'll get back to the iPad. I want y'all to see my face. A copay. This means, hey, when I go to do a visit that the insurance technically should pay for, since I'm paying them every month, they said again that they want me to share the burden of the finances. And so they said you should have a copay. So we're copaying together. We're copaying together. How fun is this? I know you pay me to pay for your health insurance, but we're going to copay together. Okay? So this is a fixed amount you pay for specific services. So for example, the common thing that many of you know is, hey, I want to go in and get my physical checkup. I don't know. Maybe I'm feeling a little sick. I want to go see my primary care physician. And you go in and they say, hey, listen, your copay is $15, $30, $50, whatever it might be to see this person. And the more specialized or more expensive a service is, the higher the copay it is. So you might go in for imaging, and that copay might be $100, might be $200. You go see a specialist, right? That copay might be $80, like double whatever your primary care visit is, whatever it is. So copays, right, is this what you're paying in a fixed fee for a service. The other nuanced term is co-insurance, which means, hey, listen, I know you're paying me to insure you as the insurance company, but I think you should also insure your stuff too. And so, yeah, we'll pay for stuff, but we want you to pay for a percentage of it. And so what happens here is even though you pay a monthly premium in totality, the insurance company says, listen, we're not going to pay for all of this service. We want to only pay for a percentage of it. So instead of paying for 100% of your emergency department visit, for example, we're going to pay for 80%, but you, the patient, needs to cover 20% of that visit. So for example, you go to the emergency department and it's a $10,000 visit, right? You're going to be paying $2,000 out of pocket. Worse, what if you have to go for a massive surgery that's $50,000 or $100,000? Then you're coming out of pocket 20% of that. That's $20,000 potentially. So this is where people get into trouble, right? So copay is co-insurance. The last thing is your out-of-pocket maximum, meaning, okay, listen, yes, you have a deductible to meet, and then we're going to also have copays. But then every year, you know what, because we're such good guys, we're going to tell you this is the maximum you can spend every single year in your healthcare, and we're going to cap it at that. And this is basically catastrophic coverage, right? You go, you need a super long ICU stay, you know, something devastating happens in a year. This caps your ultimate risk and liability as the person. Your out-of-pocket max is your safety net to grab you so you don't fall completely into despair of millions of dollars of debt. And so that's the amount the insurance will cover after you meet that. They'll cover 100% of all costs. Even if you have a copay, whatever, they'll cover all that stuff. So in 2023, the average out-of-pocket maximum for an individual, $8,700. For families, it can be as high as $17,000, guys. How many of you guys have spent $8,700 in a year on healthcare? The answer is no. Right? You don't do that. And so you guys can see they have all these different terms. You think, okay, I'm paying this much for insurance. Well, yeah, I'm paying that much, but then you got to factor in the deductible. You got to factor in the copay, the co-insurance, the out-of-pocket maximum, all these factors that make it so that things that should technically be covered, that you think are going to be covered by your insurance, aren't actually covered. And it becomes problematic. Does that make sense to everybody? Yes, yes? Say yes if it makes sense to everybody on here. Okay. So now that we understand all the vocabulary, it's important that we understand how health insurance companies make money off of everybody. And so we have to break that down so we can see it and be very clear on it. So let me bring the iPad back for us. It's good to see everybody here. Robert, what up? Okay, we're back with the iPad. All right, everybody ready? Okay, so now we're gonna get into how insurance companies make money. It's super, super simple. You are a person and you're like, hey, listen, healthcare is expensive. I wanna be covered, so I need some health insurance. And the insurance company's like, okay, cool. We want to insure you. And the way insurance works is insurance companies are right here in the middle. We have all these people. The insurance company collects all these premiums up front from people. So it creates this big pot of money in the insurance company. The insurance company wants to maximize profits. So at the start of the year, the insurance company has 100% profit because they have all the money. Every single time the insurance company pays for care for a person, their profits drop. Does that make sense to everybody? They collect all the money up front. They get 100%. So at the beginning of the year, whoo, insurance companies are 100% profitable. It's all profit. Over the year, as people use services, they pull money out of the pool and the insurance company's profits drop. So as an insurance company, the way that I'm thinking I'm going to make the most money is that I have to collect as much money as possible up front. So I want to have the most amount of people enrolled, and I want to charge them the highest premiums possible to get all this money in my pool. So that way it's big bottom line, our maximum profit line is super huge. So I'm going to collect as much money as possible by having as many people in there and having as much money in there as possible. The second part of this is that as the insurance company, so the first part is get money as much as possible. The second part is keep money. So we want to pay out of this pool as little as possible. I want to get all the money. Everybody, give me your money. I'm an insurance company. I'll help you out. And then I'm going to keep as much of the money as I can. That's the only way an insurance company can be profitable. Does everybody understand? So the insurance company's interest, and this is not debatable, the insurance company's interest is to be profitable, period. They are for-profit companies who are looking to maximize profits. And the only way they can make money is to get as much money as possible and to keep as much money as possible in that pool and not pay out for services. So how do insurance companies cut costs on claims? How do they do it, y'all? Insurance companies want to pay out as little as possible. So the very first thing they do, and Mike put in the box here, they do low risk, high risk pools. So insurance companies will deny you if you have pre-existing conditions. Insurance companies want to have the healthiest pool of people. I want all you young people to give me your money because I know young people don't get sick, don't need to be in the hospital, don't go to the ICU, don't need medications, don't need all these things. So I know I'm going to keep most of your money. And if you're old or if you're sick or if you have a condition, I want to deny you services. I want to make sure that you don't get into my pool because you have a higher risk of pulling money out. And so what insurance companies are looking at is like, I want to have all healthy people and no old people. And this is a sidebar. This is why Medicare and Medicaid struggle so much because Medicare has the old people who are the highest utilizers and they have the smallest pool of money. Medicaid has, the lowest socioeconomic status people, and it has people with disabilities. So all these people are higher utilizers than the average individual, and they have a smaller pool of money. So private insurance companies have big pools of money, lots of healthy people. And this is a conversation for another day we'll get into, but this was one of the arguments for making universal health care a thing. Because then what you would do is take all the young people that go to private insurance companies and give them their money and don't pull any back, and you put all of them into the Medicare and Medicaid pools, and you make that pool much less risky. And so you make Medicare and Medicaid much more sustainable, much more robust, and much better for the people who need what? The care the most. And you take out the for-profit entity of these private insurance companies. But anyway, okay, so money in the pool, money out. So the very first thing insurance companies do is they want to keep people who are high risk out. The second thing they do is once people are in the pool, is they say, okay, now you're in the pool, we're going to make sure that we minimize the amount of claims we pay out by denying claims. Okay? So, the way healthcare works, and you access it as a patient, is that you have to get pre-approval to go in for services. And so when you say, hey, listen, I'm a patient, and you know what, my knee's really been bothering me. I'd love to go get imaging on my knee. The insurance company says what? Well, listen, even though the MRI would tell us about the ligaments, and this just happened to me. My daughter took my knee out at the trampoline park. And I'm a physician, so I know, hey, listen, you know what? My knee's jacked up. It's not broken, but there's definitely some, ligament, meniscus, or something weird going on in there. I need an MRI to see that kind of stuff. An X-ray won't pick this up. And so I went to my primary care provider. Hey, listen, my knee's jacked up. I'm like, oh, yeah, it does feel kind of jacked up. I said, listen, I need an MRI. They're like, oh, I'd love to order an MRI, but I can't. Insurance companies have to order the X-ray first. You also have to go to PT, physical therapy, for 6 weeks. And then after those 6 weeks, then they'll cover the MRI. And the reason the insurance company does this is what, y'all? Because most people are like, oh, okay, I'll get the X-ray out. I'm not going to get to that. And then I'm not going to fall through the PT. And they're hoping to avoid having to pay for the real imaging I need, which is the MRI. So insurance companies want to deny claims. Did you guys know that up to 20% of all healthcare claims are denied initially? And of those, over half, patients don't appeal. And so as a result, insurance companies need to keep that money they potentially had to pay out. The other way that insurance companies save money and save payouts is they narrow their networks. And so they limit who's an in-network provider. And by doing this and limiting this, they limit what, guys? Access to care. And what is one of the big things we always talk about? Access to care. Maximize access to care. Well, insurance companies limit access to care. So that way, what? If the provider's not in network, you get to see someone out network, because that's where you can get to and that's what you have access to. What happens? You have to pay out of pocket for that. And so again, saves them money. The other way that insurance companies keep money in the pool, keep it earning interest, is they delay payments. So, for example, Medicaid and Medicare have 90 days to pay out. And so this is what happens. So as we frame this whole discussion, I own an anesthesia practice. So I do insurance billing, right? I have to do all this stuff. And so the easiest example is Medicaid. In California, it's Medi-Cal. When I bill Medi-Cal, I send them, I do the work. I've already done the work. I put a patient to sleep. I've done all the care, all that stuff. After I do the care, I have to fill out all this paperwork. I have to send it to Medi-Cal. Medi-Cal looks at it. They have 90 days to respond. Not 90 days to pay. They have 90 days to respond. So what they do is they take their sweet time getting back to me, and maybe it's called 60 days after I submit, I get a letter back that says, hey, you know what? Is this a comma or a period right now? Right there. I can't see what that is. Can you clarify what that is and get back to us? They send me that letter. So I'm like, oh gosh, let me send this back to them. So I send it back, hey, it's a comma. Please pay me. They have what? Another 90 days to pay out. Oh, you know what? We didn't get past this comma last time. We were confused about that, but now we're confused about this. Can you clarify this? And then the days go on, the days go on, the days go on, and it's delayed. And then through these delays, what ends up happening is a lot of billing departments will settle. They'll call the insurance company and they'll say, hey, insurance company, we really need this cash flow. We did the service 6 months ago. We've been waiting on this. What can you do? And the insurance company goes, well, it's really tough. You know, you made a couple errors here in your billing and in this 50-page document you sent us. But you know what we can do because we're such good guys? We're going to go ahead and give you, if you're willing to take it today, we'll give you 50% of what you billed for. What do you think? And if you're a business, cash flow is king. Well, I haven't gotten paid for 6 months. Oh gosh, all right, I'll take it. Give me 50%. And so insurance companies end up paying quarters on the dollar instead of the entire figure. Right? Imagine that. Imagine doing a job and your company's like, hey, you know what? I know we told you we'd pay you X amount of dollars per hour, but right now we ain't got it all. But if you want to get paid, we'll give you half of what we should have paid you. Sound good? It'd be terrible, right? And so by doing all this, insurance companies maximize profit. So United Health, right, their CEO, terrible. Forget what everybody's saying online, guys. No one deserves to get shot for nothing. Life is life and life is valuable. I think it's an awful situation that guy got shot. Awful situation. Awful, awful, terrible, no good. No one should lose their life. But I think one of the positive things that comes out of it is it makes people question, well, why would someone take someone's life? It's such a huge act to do. What's going on? What's he's so indignant about, right? Deny, delay, depose? Was that written on the bullets? He might be mad about how they do insurance billing, right? It might have been failed by the system. And so United Health revenue was $324 billion in 2022. That's a 12% increase from 2021. Yes? Of that, you're like, well, listen, that's total revenue, but what's the profit on that? $20 billion. United Health Group made $20 billion, not in like all their whole lifetime. In 1 year, they made $20 billion of profit. How does that happen? We increase premiums and we cut costs on claims. That's how we maximize 20 billion. So that means people paid in, let's call it 100 billion into the pod, right? We pay 100 billion into here. That means they only paid out 80 billion. They keep 20 billion in that pot that should have been used for stuff that you need. Yes? Does that make sense to everybody? And so I touched on this, right? And we're talking about this, but the problem is it's not just a matter of, okay, who's getting paid, whatever, and we're going to get into this. It's freaking crazy, guys. So how do claims work? You go and you get care. So you visit your doctor, you get a surgery, you do whatever. You get the service. You come in, emergency department, I'm sick. Okay, doctor, I'm taking an oath, I'm going to help you. They give you service. They give you time. They give you supplies. Do all these things. Do they get paid that day? No. They, when I say they, it could be the doctor. It could be their department, right? So if the anesthesia department, the emergency department, right? It could be the surgery department, the cardiology department, whatever department, they all have billing departments. So the billing department is going to say, hey, listen, we did this. And they're going to look at the record and they're going to get all the different codes together and they're going to send a bill to whatever insurance company. Once they submit that bill, called submitting a claim, right? Let me take this off the screen. They submit that claim. The insurance company gets that claim. And like I said, they review it and they haggle back and forth based on how complete it is, how accurate it is. And what makes this super confusing and super complicated is that every insurance company has distinct separate codes. Every insurance company has distinct ways that they want the information presented. And so your billing department has to learn how each and every one of these insurance companies wants it and serve it to them the exact way they want it. As students, how frustrating is it when the teacher wants something in a certain format and it's entirely different and weird from what everybody else wants? Well, insurance companies do that, and then every single year they update their policies and what they want to see in claims. So that way, what does the organization have to do? The hospital have to do, the billing department have to do. They have to retrain on this, reorganize on this. And when you retrain, what takes? It takes time for that to happen. It takes resources and money and so forth. Again, draining resources out of the system. Yes? Okay. So people get frustrated. They don't get the whole claim back, so they accept nickels on the dollar instead of taking the whole figure. So they negotiate the dollars down. These are called adjustments, insurance adjustments. But really, it's just, hey, I don't want to pay that much, I'll pay less. So they look for reasons to deny these claims. They adjust, they reduce how much they're going to pay out. So even if they do agree to pay out, they pay out less of. And the problem with this is it's not just bad. People think it's the doctor's issue. It's not about a doctor getting paid. Doctors don't set reimbursement rates. This is the most important thing that you guys can probably learn in this life as pre-meds. When you become a doctor, unless you take only cash, and I'm actually going to have a doctor on next week. I'm interviewing her for you guys. And in her practice, she only accepts private pay patients. And people get upset at that sometimes. Like, why don't you accept insurance? And what she will articulate to you guys, we'll talk a lot about private practice, a lot of good stuff for you guys to get next week. But one of the things that becomes clear is the headache, the expense, and the sacrifice you have to make to deal with insurance isn't always worth it. And so you end up doing all this work and not getting paid. And how does that make your soul feel? Right? And so you can't survive on nothing. You have a family support, you have all these expensive doctor loans, all these kind of things. And so it makes it very difficult for people to accept care. So what happens is you have patients now who are stuck with insurance companies trying to maximize profits. So they raise premiums, making it harder and harder to afford. So what do people do? They go without insurance. Or what's most common? They go underinsured. So they know they need a certain amount of insurance. Oh, I need these services covered, but it's too expensive. I can't afford it, so I'm underinsured, and the care I really need is not covered, and therefore what do? I don't access that care, and therefore I get sicker than I need to be because I'm not getting the care I need, and bwomp, 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 it's a spiral down. So the rising premiums hurt patients. Additionally, the higher out-of-pocket costs, and so again, physicians don't set the reimbursement rates. Insurance companies do. Insurance companies set the rates. They listen, how much should an MRI cost? That's what it should cost. Okay, sure. Right? And for patients, they have these high deductible plans. So who suffers? The patients, because they have to pay all this stuff out. Right? And the statistic now, this is crazy. These high deductible plans, I said earlier, it's going to be a big thing. These high deductible healthcare plans, 31% of Americans have a high deductible healthcare plan, meaning their insurance is going to kick in a significant way until they get to a super high dollar figure, $5,000, $7,000, $10,000. How many of you guys have $10,000 laying around right now to just, here's $10,000, no big deal. Whew, no sweat off of me. I can eat just fine without that $10,000, right? We don't. And so 31%, a third of Americans are at risk for falling victim to the bankruptcy, right? Healthcare is the number one bankruptcy tool in America, healthcare. Why? Because these high deductible plans. It also limits access to care for patients. I mentioned when care is expensive, do we go? You know what? Yeah, this toe is really hurting, but I'm not going to go in. It's too expensive for me to go in. You know what? My sugars are out of control, but I can't afford my insulin, so I'm not going to get that care. You know what? I really do need to see this doctor, but they're not network. I'm not going to worry about it. I'm just going to see my primary care provider. You know what? I can't even see my primary care provider. The copay is too expensive. The co-insurance is too expensive. I'm just going to go to the emergency department. They'll treat me for free. Ooh, right? This is the problem. And so it goes round and round and round around the bend with the patient suffering. We haven't even gotten to the fact that the physicians suffer because these physicians, and this is what happens to healthcare, you don't see private practice anymore where it's like one physician and they hang up a shingle, because it's all about negotiation. I mentioned the insurance companies set the rate, and the insurance companies decide who's in network and who's out of network. So if you want to get paid in a real way from insurance companies, you have to play the game. So the insurance company says, you want to be a network? Sure, you can be a network. Yeah, you're saying that surgery, the open heart surgery, you say it costs $10,000? Okay, cool, that's fine. But in order to be a network, we're going to pay you $5,000 a surgery. Do you want to be a network or not? So they set the rate, guys. And so for physicians, you have huge med school loans. You spent an inordinate amount of your time becoming the physician. You work hard in a stressful, crazy environment all day, and you don't get paid what is right and just for you. Like I said, physician salaries are not adjusted for inflation every single year. In fact, many physician salaries actually go down every year because of these pinches. And so what happens to the physician, y'all? They have to be more productive to make the same wage they used to make not being as productive. So they have to see more patients. They have to move faster. How do you guys feel like your doctor is rushing? This is the pressure put on them by a healthcare system that is broken. And who has broken it? Who broke the vase? Insurance companies broke the vase. Insurance companies serve no function in healthcare other than to provide a barrier, a buffer, a obstacle, to provide a wall between patients and providers. I don't know if you guys saw it today. I took a screenshot of it because I thought it was a fantastic illustration of what is happening here. But there was an article quoting the new CEO for United Health Group. Do you guys see this? Who saw this? I'm going to blow your mind right now. You guys ready? So United Health CEO just got shot last week, killed. Then I have a replacement CEO. Yes? This replacement CEO said, here we go. You ready? Our company will continue to prevent unnecessary and unsafe care after the fatal shooting of our previous CEO. We make sure that care is safe, appropriate, and is delivered when people need it, and we guard against the pressures that exist for unsafe or unnecessary care to be delivered in a way that makes the whole system too complex and ultimately unsustainable. Listen to what he said. We make sure that care is safe, appropriate, and delivered when people need it. We guard against pressures. So the insurance companies are making the decisions, the medical decisions that medical doctors have trained for their whole lives. Insurance companies are deciding what care you need, when you need it, and how you need it. Does that make sense to anybody? Wouldn't it be great if the doctor who's actually seen you and who's gone to medical school got to decide what care you need when you need it? Not the insurance companies? Would that be fantastic? And we're gonna get into some really specific examples next time where I really start to break this stuff down so you guys understand what's happening here and the real squeeze and the real logistics of this. It's nightmarish. It's worse than what you could imagine right now. I'm gonna bring some real examples. Maybe you get in trouble, maybe I don't, but I'm gonna give you guys some real examples of how this game is played and how the patients suffer, how the physician suffers, and how insurance companies win the day. Have we had enough for today? 36 minutes? Does everyone have a basic understanding of this system right here and how it goes? We're going to be back later this week, right? This is a series. I'll probably do 4 or 5 episodes on this because it's that involved and that enthralled. We haven't gotten to the anesthesia craziness. We're talking about anesthesiologists trying to overbill us crazy, greedy anesthesiologists. But we're going to get into this, guys, because it's so important. If you guys are healthcare providers of tomorrow, you must understand the economics of healthcare. And one of the reasons this system is so bad and has gotten here is because physicians, and I tell my students all the time, if you guys have heard me talk about this on here, do not be a martyr, do not be a slave, do not think that you owe anybody anything. You owe yourself first and foremost. There is this culture in medical training that trains you to say, I will give eternally for whatever, and I expect nothing in return. And it's just like the book, The Giving Tree. I don't think you guys ever read this book, The Giving Tree. Who's ever read The Giving Tree? This is the perfect example of healthcare. In the Giving Tree, if you guys never read it, I'm going to summarize real quick. There is a young boy and there's a tree. It's beautiful. Oh, branches, apples everywhere. You guys, you pre-meds, the future of healthcare are the tree. You've got all this zest for life. You're excited to help people. I want to save my community. Oh, I want to do it. You're all excited. And you go through healthcare, and the healthcare system is a little boy. It says, hey, you know what? I could really use a refreshing apple. Could you give me an apple? And you give them an apple. Oh, thank you, tree. And they run off, eat your apple. Oh, I'm so hungry again. Let me have another apple, another apple, another apple. Then all the apples are gone. It's like, oh, okay, that's all right. You know what? I really could just use some shade from your branch. Oh, you know what? I'm gonna take these leaves. I'm gonna build a wonderful little leaf outfit. Oh, great. Now you have no leaves. Oh, it's okay. Don't worry about that. How about your branches? I'd love to use your branches to build myself a nice fancy house. Is that okay? Sure, take these branches. Go ahead, little kid. Healthcare, take my branches. And oh, now you're just a tree. Oh, you know what, tree? I know you're just a trunk there, but I really need an addition to my house. Can I take your trunk? Oh yeah, go ahead, take that. No big deal. And now you're just a stump. And then even when you're worn down to just a stump, like, gosh, dang, can I catch a break? Healthcare sits on your gosh darn head and rests on it. That's healthcare. Don't be a sacrificial lamb. Understand the economics. And for too long, healthcare providers have been in this mode of, it's all about serving the patient. It's all about giving everything I have. I can't think about money. To think about money is a sin. It makes me greedy. All these kind of things. And physicians and other leaders in healthcare, right, the provider side, took their eye off the economics and said, no, let the CEOs, let the business people, let them handle this stuff. And at the end of the day, the people who suffer are the physicians and the patients. And it starts with the fact that physicians let control of the reins go and said, we can't talk about money. Money, money, money. And I've worked in healthcare contracts and doing healthcare new hire contracts. And I can tell you the statistics on the percentage of people, most new hires as physicians don't read the totality of their healthcare contract. They don't know the ins and outs of their payments. They just know, okay, here's the bottom line, what I'm gonna get, and here are my basic benefits. And they don't understand the economics on the other side of it to actually know what their true number is. And so a lot of new grads come out and they make way less than what they anticipated because they didn't understand magnifiers, multipliers, deductors. They didn't understand all these matrices and revenue sharing. They didn't understand all these things and they get terribly screwed. And so it's so important as young people, learn this, take this to mind. As young people, money matters because money motivates. And if you can have a handle on the money, you can see what's motivating people. And you can change their motivation by moving that money around. But you gotta have control of the money. And for patients, we have to pay closer attention to where our money's actually going. What is our premium? What is our deductible? Where's our coinsurance? Where's the money going? And how much money am I getting back? And we have to fight for that money and recognize, no, it's not the insurance company's money. It's my gosh darn money, and they stole it. And they better give it back to me and pay for some gosh darn services around here. Does everybody understand? We have to pay attention. People have to be held account. In our healthcare system, we got to stop acting like physicians are greedy. We got to stop acting like doctors. All they want to do is stack cash and do nothing. It's not a true sentiment. And for you guys as young people, recognize you are not a bad person to talk about the economics. And as someone who grew up without money, I can tell you, not having money is not a good situation. And as someone who's moved both on the business side of healthcare and on the provider side of healthcare, if we don't get the money situation fixed, we can't fix the care situation because that's the major hurdle, the major obstacle to providing effective patient care, patient-centric, high-level care is the money. And who controls the money in healthcare, y'all? Is it clear? Health insurance companies. So this is the basics. We're going to level up and go up a notch next time. And we're going to go up another notch. And we're going to talk about all the specifics. We're talk about why healthcare costs keep rising. We're going to talk about the complex premiums paradox. We're going to talk about, right, all of the things that go in, pharmaceutical drugs. We're going to talk about what's happening in medical training and the economics of medical training. We're going to talk about why doctors are struggling. We're talking about the hospital economics and what the hospital's doing and that side of it. We're going to talk about all of this so that way you guys can have an understanding of what is happening in healthcare so you guys can be the future leaders to make the change, to make it patient-centric again, to make it physician-friendly again. so that physicians want to practice and over half of them aren't burnt out, wanting to quit, looking for other opportunities because they know it's killing them slowly. And we're going to talk about ultimately what needs to change and how we're going to do it, y'all. Right? Because it's always about action here. When you come to this channel, yes, information, yes, but it's about the action. But we first have to be informed. And once we have that information, we are informed, we are aware, we know what's going on, we know the key things behind it, the background, and now we can take action to make things change. So we're going to talk about this. I hope you guys enjoyed this. If you've enjoyed this, take a second, like this video right now. Take a second, comment, let me know. Hey, Dr. Python, I appreciate you spending 43 minutes with me breaking down this stuff that I didn't think about before, maybe, that I couldn't see what was happening, right? That now you've provided some clarity and some depth. You took the time. You didn't give me a 10-second reel. You took the time to give me 43 minutes in part 1 of what is a multi-part series to really help me understand what is happening in healthcare and why people are sicker, both on the patient side and on the provider side, while insurance companies make record gosh darn profits every year. It is sickening. It is a scam. I agree. But we have to be aware, otherwise we're going to fall victim to the same scam over and over again, guys. I'm out of here. I'll see you guys. Keep a lookout. If you aren't already, subscribe to my channel, turn on live notifications. So that way you know when I schedule this next live and you're ready to get it. I'm going to have interviews. I'm going to have experts on here because, again, it's not about opinions, y'all. It's about facts. And what the facts tell us is not what my opinion is what I know. This is the facts of the case. Right? The truth. All right, y'all. So thank you. I'm glad you guys enjoyed this. Let's hit the outro and let's get up out of here, y'all. See you guys very, very soon. Later.
That's it for another episode of the Pre-Med Productivity Podcast. Show your love by smashing the like button and commenting in the box below. Today is the day, guys. No more excuses, no more complaining. You're going to take your future into your own hands. You're going to dominate. You're going to be successful. I challenge you. What are you going to do today to make your life better? Get to my website, premedproductivity.com. Grab a free ebook, sign up for a free webinar, and if you're really ready to transform, enroll in one of my life-changing courses or coaching programs. You have greatness inside you. Let me show you how to unlock it so you can dominate and make your dreams a reality. No excuses, just dominate.